Welcome. I'm a bit nervous. I've been giving this speech before, but never to what I presume to be my peers. I've been talking about this to policymakers, and that's quite different from this crowd. It's about electronic patient records. But first I want to announce something else. After more than 10 years, this really, really big fight between Scientology and Access for All, an internet provider in the Netherlands, and myself over websites containing so-called secretive material has finally been resolved. The whole fight has been all over the net, but the fact that we finally won has not been. And I'm so relieved. After 10 years of court cases, we're over and done with. Supreme Court has spoken. We're done. We have won. This book on the electronic patient records that I made is part of a new series that I'm publishing. It's going to be 6 books in 3 years. It's all about the social effects of technology. We would like to write about underexposed subjects such as these electronic patient records, and we always try to sort of mix theory and practice. The first one was about electronic patient records, the second one will be about the economics within gaming, and the third one will be about Web 2.0, and for the rest we have as of yet no clue. If you have any ideas, you're most welcome. Why a book on electronic patient records? The whole debate about them has been going on for at least 10 years in the Netherlands, but there has been no public debate whatsoever about its premises, its goals, its whys, its hows, the whole implementation, what should be in them, who should access them. There's been no public debate whatsoever. Well, it's a really, really important subject. Newspapers have not been doing much more than just sort of progress reports, press releases. The Minister of Health signed a new contract with so-and-so. That's the kind of information that we've been having in the Netherlands about this really big project that's going on. At the same time, you can see that all the policymakers have this sort of absolute faith in technology. This new technology is going to solve everything. It's going to be the new Valhalla. It's going to be the new heaven on earth. So what I wanted to do was to examine the premises, and actually as a sort of hidden agenda, I hoped to help to resensitize people to issues regarding privacy. We all think that privacy is dead, but I do think and do believe that in matters of health and finances, people do value their privacy quite a lot, and actually more than we think. So this, I thought, was a nice subject to make people a bit sensitive again about privacy. The whole idea behind this electronic patient records can be summed up as in this way. Everybody hopes to make medical information more accessible nationwide. So instead of just my GP having my information, GPs all over the country can access my medical records. Also, because they can access it at the same time, real time, they all can share the same information. By now, my GP can send information to my specialist can send a letter back, but by the time my specialist gets the letter from the GP, things might have changed in this. He might have entered new information, which, if it's all done by letter, is really difficult. So this whole idea is that everybody can access the same information in real time, without too much delay, without paperwork. And thereby also the government hopes to enforce cooperation and sharing, which becomes more and more important because the Dutch have embarked on this really big project of making, well, not healthcare, but the financing of healthcare a bit more privatized. And so by now everybody is competing over patients, which also means that people are a bit less prone to share information than they were a couple of years ago. So this electronic patient record is also meant to reinforce cooperation amongst doctors. So to sum it up, it would reduce bureaucracy because there would be less paperwork. It would increase efficiency because everybody had actual real-time information. Thereby, it would reduce medical errors, such as giving people the wrong medication, not knowing that some other doctor had already given them medicine A while you were prescribing medicine B, which actually conflicts, which then makes people end up in the hospital. So that kind of medical errors would be reduced. And thus, in the end, it would reduce costs. That was the whole government aim. This is sort of description of the old situation. You have all these people, all these institutes, pharmacy, specialists, laboratories, GPs, physiotherapists, all communicating with one another over your records, and everything goes by mail, snail mail. Sometimes they use Edifact, which is a sort of, well, it's not email, but it's sort of electronic message, which is coded in a certain way. But that's, first of all, it's very expensive. Secondly, it's slow. Thirdly, it needs the cooperation of both. So my GP can only get the Edifact message from my specialist if he first asks for it, and then the specialist needs to agree, and it's not done in real time. So this is all a very, very slow way of communicating. That's the depiction of the old situation. And the prime thing is that in the old situation, information is kept, the real information is kept at its nexus. My GP has my information that he obtained. The specialist has his own set of information. If the specialist sends information to the GP, he then stores it again. It's sort of, he gets this new set of information that he adds. So the one who originated the information, that was the specialist, by now no longer possesses the information that he sent out. In the ideal situation, everybody keeps the information that they have, and others can just access it. They can browse through it. They can retrieve it, but they can't change it. So my GP can look at the information that my specialist has, but he can't change it. Only the specialist can do so. The whole idea about this electronic patient records is this yellow box. That's the so-called national exchange point that was to be implemented in a week, January 1, 2006. All specialists, GPs, laboratories can communicate with one another through this national exchange point. That was the general idea. And not all of them are ready yet to be sort of connected to this national exchange point, but one by one they will. And in the course of 4 years, or at least that was the plan, the whole Dutch nation, medical-wise, would be connected to this national exchange point. One of the problems with this whole system is that patients, of course, need to be unique. My GP in his private administration can use, well, can start at patient 0 and continue, and so can the GP in the next city. But the moment you have a nationwide system, you need to have a nationwide unification system. Of course, there was quite some discussion and debate about how to go about that. And the previous Secretary of Health, Els Borst, said, we will not, under any circumstance, use our social security number to do so, for obvious reasons, such as it makes it too easy to link data that's completely unrelated. It makes it possible to, for instance, link your financial data, your tax data, to your medical records, which is something she definitely didn't want to happen. We got a new government, we have a new climate. So hence, we got this social civil service number that's going to be implemented also January, well, that was the original idea, January 2006. A civil service number for all Dutch citizens, which actually is our social security number. What happens is our social security number is sort of promoted to the civil service number, which then is broken down again in a civil service number for work, taxes and welfare, an education number for education purposes, and a health identifying number for health and childcare and youth care. And of course, there are risks involved with having one overall number. One is very, very practical, as opposed to common belief, and actually what policymakers believe as well. Our Dutch security number is not unique. There are many, many errors, which the moment you translate that same number to the medical domain becomes very, very complicated, because it means that while patient A is being checked in and his or her records are being retrieved, if you work under the assumption that that's a unique number, you have no qualms about re-identifying that person. But if that number is not unique, you might end up with the wrong information anyway. And that's a problem that has not been taken care of in the whole deployment, implementation, debate, all the security measures that have been surrounding this electronic patient record system. Our social security number is not unique, and hence our healthcare information number is not unique. Of course, we will get the unwanted, the unforeseen, and the unaccounted linking of personal data in various domains. It has always happened. Governments make their reservations. No, 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 we will not do this. But in the end, it very often does happen. A very practical problem is also that by having one number that's to be deployed in different areas of life, a same number, you really make it much more easy for people to engage in identity theft. In the US, it's becoming a really big problem. I think that practices such as the Dutch, using one overall number for all areas of life, actually encourage identity theft in the Netherlands. Of course, we have the political problems. Currently, the law is being extended, the laws on privacy, with regards to data linking, because we're going to have this new civil service number. And actually, from its inception, it has been meant to assist law enforcement and investigation, as this quote will show you. This was a quote in a letter that the government sent to Parliament in the year 2002. It said that implementing this overall personal number is important to meet the desire to have more means available to link data for purposes of law enforcement and investigation. Remind you, they're talking about health care information number here. Extending the legal possibilities to do so is being considered within the current European privacy directives. Well, that sounds not too comfortable when you know that the whole data retention law is, from its inception, known to be breaking the current European privacy directive. So this kind of, no, 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 it's okay, we won't do anything bad, trust us, trust us, trust us, is not something that I trust, because at the moment the governments are breaking that same law. Already, while this Dutch civil service number is not yet implemented in law, it was supposed to be done by now, but everything is of course taking a bit more time as per usual. So while there is not a law at the moment, already companies are promoting a wider spread use of the civil service number than is planned. By now, they're already arguing that they themselves should be able to use this civil number for their own administration to make themselves, well, to make their own work more cost effective. This is a quote from a sort of organization for companies, and the whole press release was, you can see it at the bottom, the whole press release was called "Privacy Obstructs Efficiency." It gives you an idea of where we're heading. To make it more complicated, the government in the Netherlands has been eager for a couple of years already to introduce a new identity card. We all have our passports, which will soon be biometric. And the argumentation for that has always been, yeah, but we need to give our citizens a biometric passport in case they want to go to the US, because the US demands biometrics in passports. Not as in, but we want to have it ourselves. No, it's really, it's America's fault. We can't help it. But at the same time, and it's been badly publicized, but it has been going on, they've been eager to introduce their own biometric electronic national ID card. And they've been doing so for years. But one of the really big problems is that such an ID card is going to be expensive precisely because of the biometrics. And they could not really explain to the general at large why they should have this electronic national biometric card, because there was nothing to go with it, nothing that would make it attractive to citizens. As in, if you once have this new electronic card, you can do so and so and so and so. But suddenly, this summer, the Department of Health came up with this brilliant solution. We're all going to need an electronic biometric ID card so that we, patients, we ourselves, can access our own electronic patient records over the internet, and we can consult what our GP has about us, what our specialist has about us, and what have you. So suddenly there was this first, what do you call it? Application for the ANIC, which made the ANIC suddenly look viable in the eyes of the government, and by now we are going to have it. While at the same time, we have this sort of digital ID already in the Netherlands, which is again based on your social security number. So you can actually use that to access electronic patient